Greetings from the Gurukul Global Academy. A very warm welcome to all for joining us today for this enriching online session. On behalf of the Gurukul Global Academy, it is my great pleasure to welcome you in today's online session scheduled on 18th March 2026 from 3 to 4 p.m. Let me introduce about the Gurukul Global Academy. We have the mission of building the future of healthcare. We offer you 25 plus super specialty courses in Ayurveda with the integration of Ayurveda and modern science. We also conduct clinical meetings, CMEs, workshops, and hands-on training. Before starting our today's session, please pray for Lord Dhanvantari.
नमामि धन्वन्तरीरादिदेवं सुरासुर वन्दितपादपद्मं लोके जरारुक् भयमृत्युनाशं दातारमीशं विविधौषधीनां शङ्खं चक्रं जलौकां दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यांशुक परिविलसन् मौलिमं भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारु पीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन् प्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्.
Just to brief about the Gurukul Global Academy, you can email us at thegurukul@parasnaclinics.com. You can visit our website, thegurukulglobalacademy.co.in. If you have any queries, you can WhatsApp us on 9969119134. Next. We had conducted CME on 7th Feb 2026. Just take a look at this. As you all know, we are in our today's third lecture and we are organizing this 6 days free webinar on Panchakarma. Next. We are gathered online here to explore a highly insightful and significant topic, principles and practices of Basti Chikitsa. This session is a part of 6 days free webinar series on Panchakarma, aimed at deepening our understanding of traditional Ayurvedic therapies and their practical applications in healthcare. Basti Chikitsa holds a central place in Panchakarma therapy and is often referred to as a half of all treatments in Ayurveda due to its profound therapeutic benefits. Today's session will help us understand its principles, techniques, and clinical relevance in comprehensive manner. It is my honor to introduce our esteemed guest speaker, Dr. Rajiv Tarpe, sir. Next. Dr. Rajiv Tarpe, sir. Sir has done BMS. Sir has done MD from Tilak Ayurved Mahavidyalaya, Pune in 2009. Currently, sir is pursuing PhD in Panchakarma from MUHS. Currently, sir is Associate Professor in Department of Panchakarma at R.A. Poddar Medical College, Worli, Mumbai. Sir is approved MUHS approved PG guide. Sir has published 12 publications in national and international research journals. many papers, presentations in national and international seminars and conferences, organizing secretary at Panchakarma training course for BAMS doctors. Sir is NAC and NABH coordinator. To all our participants, thank you for taking time out for your busy schedules to join us. Your eagerness to learn and grow keeps the spirit Ayurveda alive and thriving. Without further delay, I invite our guest speaker, Dr. Rajiv Tarpe, sir, to begin our today's enlightening session. Thank you, and over to you, sir.
So, good afternoon, all of you. Respected Chairperson, Dr. Ritu Wadhwa, ma'am, and my friend, Dr. Datta Bapardekar. First of all, I would like to thank Dr. Datta Bapardekar and Gurukul Global Academy for providing me this platform to share some of my experiences regarding Basti Chikitsa. So, today we are going to see some basic principles and practices or the formulations of Basti. So the next slide, please. So as Dr. Datta rightly said about the Basti Chikitsa, it is praised as Ardha Chikitsa in Ayurveda, and due to its multidimensional capabilities and multifaceted action, it is distinct from all the other Panchakarmas like Vaman and Virichana. It has upper hand to the all other Panchakarmas. Why? Because whenever a person is indicated for Vamana and he is not able to or he is not arha for the Vamana, then the option will be Basti. Likewise, for other karmas also, Basti is alternative, and it not only serves as a Shodhan Chikitsa only, it can serve for many karmas. That's why it is called as karma guna krita. So the karmas like Langana, Bruhana, Snehana, Rukshana, all can be performed through the Basti Chikitsa, and the guna like Ayu Vruddhi, Agni Vruddhi, Bala Vruddhi can be achieved also through the use of Basti Chikitsa. That's why it is called as Sarva Guna Karma Krita. So this is the brief introduction. I think it is sufficient for the information regarding Basti Chikitsa. In this presentation, we will going to, as we all know, it is a very vast subject. I confined it some of the principles and the formulations. So in today's lecture, we will see the Nirva formulations, Anuvasan formulations, and the ideas behind using it as a Yugma Basti Chikitsa or Doshotkleshan Dosha and Dosha Shamana Chikitsa. So in this regard, we will see the principles and the ideas behind it. Okay. Next slide, please. So see here, in Breathray, we have around 166 total formulations available. The number goes up to 194, but some of them are repeated by another names in another text. That's why the number is reduced at 166 only. So as we see here, 136 total formulations are there mentioned in Charak Samhita, 34 in Sushruta Samhita, and 24 in Vagbhat Samhita. So the number is a decline as the time progresses. Okay. So majorly we know that there are two types of Basti. One is Niruha and Anuvasana. So under the umbrella of Niruha, there is a mention of Prasruta Yogika Basti, Siddha Basti, Karma Basti, Yapana Basti, and Madhutailik Basti. So we all know these types of Basti are mentioned in Samhitas. So mostly the Bastis are there in Charaka Samhita. And as far as Anuvasana Basti is concerned, for the Anuvasana Basti, the Siddha Tailas are mentioned there. 10 indistinct Anuvasana Tailas, Siddha Tailas are mentioned for Anuvasana Basti, and 37 Siddha Tailas prepared from the same Niro Basti Dravyas are also mentioned there. So these are the numbers present in the Brihatri only. So we need to read these things and try to whenever we can able to use it. So that's why I put the number over here. So next slide, please. So Niroha Basti. See, in Niroha Basti, the ingredients are, as we know, Saindava, Madhu, Sneha, Kalka, Kwat, and Prakshep is there. So the quantity of ingredient will should be varied according to the uh, dosha avastha. So in Vangasena Samhita and in Bhav Prakash Samhita, the dosages or the quantity is described there by the acharyas. So it is a guiding light for all of us. If we are confident about assessing the dosha, and then we can use in such quantity the sneha and madhu. So for vata, Vangasena has recommended 6 pearl of sneha. Actually, we know the Dwadash Prasrutika Basti is the total quantity of the Basti, and among that, he mentioned that 6 pearl of Sneha should be used. For Kapha, 6 pearl Madhu should be used. So, this is the ingredient variation mentioned by Vangasena, and Vagbhata also, sorry, Bhavaprakash also mentioned some sort of differentiation in the quantity of the ingredient. Okay, so we need to look at this aspect of the neurovasti first of all. Next slide, please. Formulation or the preparation of the neurovasti is the most important thing. We must follow the protocols of the preparation of the neurovasti. Uh, First of all, Saindava and Madhu should be mixed in khala. Why? Because it needs more pressure to mix it and form a homogeneous uniform base. And after that, when you add sneha in it, you should add it gradually. If you pour it at once, it will not be mixed at anyhow. So to mix it properly, gradually integrating sneha should be needed. And then after a homogeneous emulsified mixture can be available, and then after you add kalka in it, and then also torture it for some time, and then after add decoction and prakshepa, and mix it with blender. So this is the preparation protocol. This is a very much important, and many times Vedya ignore it, and to avail the maximum results, we must follow this protocol and other to it. Okay. So next slide, please. Uh, After knowing about the Basti preparation, we must know the Basti protocol. So, what is the Purva Karma of Basti? What is the Paschat Karma of Basti? And how it should be administered? So, when we are going to use Niruha Basti, there is a narration of Purva Karma, Sarvanga Snehana, and Sarvanga Svedana. So, it is must. So, see, Niruha Basti is basically for Shodhana Karma. And before Shodhana, the body should be prepared for the Shodhana Chikitsa, and by Snehana and Svedana, it is been prepared, and that's why when we administer Shodhana Niruha, Shodhana Karma can be performed easily, and there will be no harm to the body. That's why Sneha and Svedana is must before Niruha Karma. And about Anuvasana, there is only narration of Sarvanga Snehana, and Ushna Ambu Snana is mentioned there. For because in Anuvasana, by Anuvasana, we are performing Snehana Karma. So there is no need of Svedana there, or the Prabala Svedana is not mentioned there. So in this way, you should administer Anuvasana and Niruha. As the procedure described for Niruha Basti. For Anuvasana, you should add only to Tela and Saindava and Shatapushpa. So the ingredient of Anuvasana Basti is simple. Taila, Saindava and Shatapushpa is there only. So in this way you prepare Niruha Basti and Anuvasana Basti. And in Charaka Samhita, when the time of administration or the duration of time of duration of administration is mentioned. So he said that you should administer continuously 1, 2, 3 or 4 Asthapan Bastis or Niroha Bastis, and then after you administer Anuvasana Basti. Why this is so? See, if there is a Santarpanota Samprapti, then and you are giving a Niruha Basti. So until the Samyaka Niruhana Lakshana appear, you have to continue it. Okay. And then only you have to go for the Anuvasana. And when you start Anuvasana Basti, then also you have to continue for 1, 2, 3 or 4 Bastis till the Samyaka Snehana Lakshanas get achieved. So this is the basic guiding principle of administration of Niruha Basti or Anuvasana Basti. Okay, and after the administration of Basti, when for up about Paschatkarma, when Niro is administered and it came out or Basti Pratyagam will be there, then after a patient should take warm water bath and consume light meal. If the patient has a Vata Pradhana Samprapti, then he should consume Maunsaras with Odana. And if the Pitta Dosha Samprapti is there, then he should consume Kshira or Dugdha with Odana. Likewise for Kapha, he used get to consume Yusha with Odana. So this is the complete Basti protocol. And after that, if we are performing Basti Karma for 7 days, then we have to follow all the restrictions or rules for 14 days. So the Dviparihara Kala is mentioned over there for all the rules or restrictions of sleep, food, celibacy and all that. Okay. So this way you have to perform a general Basti Karma. So next we will see about Sneha Basti. Next slide, please. As I mentioned before, the Niruha Basti and Sneha Basti. Sneha Basti is mentioned there in Sushruta Samhita. There are 3 types mentioned in Sushruta Samhita of Sneha Basti. So they are based on the quantity. So the 240 ml is the quantity of Sneha Basti, and it requires 24 hours of digestion also. So half of that is Anuvasan Basti, which goes around 120 ml, and half of it is Matra Basti, which goes around 60 ml. When you are administering Sneha Basti, what happens in the body is very nicely described there in Sushruta Samhita. Sushruta says when first Sneha Basti enters in the body, it oleates bladder and inguinal region. Then after it acts at Murdha Pradesh. Then after it acts on Udana Vayu. And then after the 4th Basti acts on Rasadhatu. And sequentially it acts further on Rakta Dhatu, Mansa Dhatu, Meda Dhatu, Asti and Majja. So if you properly administer Sneha Basti, then in this sequence it acts on various dhatus. Okay. So this is Niroha Basti and Sneha Basti. Now we will see the Yugma Basti Sankalpana. Okay. Next slide, please. So we have seen administration of Niruha and Sneha Basti. So firstly, they mentioned that continuously you have to give 4 Bastis or 3 Bastis till the Samyak Rukshana Lakshana is achieved. So in Yugma Basti Sankalpana, there is a narration that you have to administer the Sneha Basti and Niro Basti alternately, alternate in a day or alternate daily. So you can use this sort of set of bastis when there is a Dvidosha Samprapti or Tridosha Samprapti. So there are certain criteria where to use Yoga Basti, where to use Kala Basti, where to use Karma Basti. So here two things happen. Vagbata rightly mentioned that Sneha Shodhan Yuktya Eva Basti Karma Tridoshajit. When there is a Tridosha Samprapti or Vidosha Samprapti, you have to go for a Yugma Basti uh, for formulation. Okay. Next slide, please. So here are the criteria given for and the sequence of Yoga Basti, Kala Basti, and Karma Basti. When a person is stronger and has a strong pathology, he should go for Karma Basti. In that Karma Basti, 18 are Anuvasana Bastis and 12 are Niroga Bastis. If the patient has a medium strength and the pathology also is medium, uh, then he should go for Kalabasti. And if the pathology is lesser and a person has a weak stature, then he go for Yoga Basti. So for the Shodhana purpose, one should follow such type of Basti sets accordingly. Okay. So next slide, please. So after Yugma Basti Sankalpana, in Sushruta Samhita, there is a mention of three sequential bastis. That is Dhatu Utkleshana, Dosha Hara, and Dosha Shamana bastis. See, when we perform Vaman and Virechana, we also do Snehapana. Then after we give Utkleshkar Ahara, and then after we perform Shodhana, and then after we advise Sansajan Krama. So here is also the same thing happens. When there is a lean dosha avastha, then you have to utklisht that doshas and make them able to come at Koshtha. So for that purpose, doshotkleshana basti dravyas are mentioned there. And you have to prepare a oil from that dravyas and introduce it or administer it for 1 day, 2 day, or 3 day. So there is a narration of sequence also. So you can make cycles of 3 days or weeks also. So likewise, you give 3 days continuously Doshotkleshan Basti, followed by 3 days continuous Doshar Basti, and then after for 3 days you have to give Dosha Shamana Basti. So if the Samprati is not Balwana, then you can follow this sequence. If the Samprati is Balwan, then you can go for weekly cycles. Okay, so continuously you have to go, give for 6 days you have to give Doshotkleshana Basti, and for the next 6 days you have to give Doshahara Basti. Okay, so in this way, this sequence of Doshotkleshana, Doshahara, or Dosha Shamana should be followed. So these are the some of the concepts I want to talk about. Now we will move ahead. Next slide, please. So now we will see some of the formulations which I have just mentioned regarding the concepts I have just mentioned, and I use in my practice. Next slide, please. So Dashmuladi Niro. So this is very widely used basti for all the Vat Vyadhis. So this is basically for Dhatukshay-janya Vat Vyadhi and Apatarpanotta Samprapti. When you need to perform Shodhana, you have to use Dashmuladi Niruha. And if there is a Kapha Pitta Samprapti or Kapha Pradhana Samprapti, you have to go for Eranda Muladi Niruha. So here is the quantity of the ingredient is given. 80 ml honey in Eranda Muladi, you have to use 80 ml honey, oil 100 ml, and decoction is about 400 ml, and Gomutra is there for 20 ml. So in when there is a Malavashtamba, Agni Mandya, and patient has Vata Vyadhi, So you have to be, preferably you have to go for Erandamula, and also the patient needs a good bala. So it is a Tikshna Basti. So whenever you are going to use this, you have to be cautious about the bala of the patient. So these are the two niruhas which are commonly get used in the practice. Next slide, please. Madhu Tailika Basti. See, Niruha Basti is for Shodhana, but there are some persons or certain conditions where the Shodhana is required, but the Shodhana Bala of the Upakrama cannot be tolerated by certain conditions. Then this Madhu Tailik Basti is been useful. So, Madhu Tailik Basti is indicated for the Sukumar patients, women's, child, elderly persons, delicate individuals. So, in those who have Sukumar nature, in those persons, when there is a need of Shodhana, one should must go for the Madhu Tailika Basti. So, it has very less complications. And there is also one benefit that the rules which I have just mentioned, Dviparihara Kala. In Dviparihara Kala, there are the restrictions of diet, travel, celibacy, and all that. So when you are doing administering Madhu Tailika Basti, there is a no need to follow these strict rules. But of course, don't expose to the extreme conditions. But if this is a basti where there the rules can be flexed or flexible rules are there. Okay, so this basti is very much useful. The specialty of this basti is the quantity of honey and til tela is in equal quantity. Okay, so there are 7 bastis described in Charaka Samhita. Also, the bastis are described in Sushruta also. Okay, so in this basti, uh, Eranda Mool for decoction is used for 400 ml, and Shatapushpa Madanfal Kalka is used for about 25 gram. Okay, so this is one of the distinct basti one should use. Next slide, please. Next slide, please. Sorry, sorry, the back one. Yukta Ratha Basti and Siddha Basti. So these are the types of Madhu Tailik Basti. So one who needs to travel and cannot have time to rest. So this is the Basti for him, that person. So in this Vacha, Pipali and Madhuk are the Kalkadravya, and here is also Erandamul Kwat is narrated. And quantity of honey and oil are 80 ml. Siddha Basti is there. In Siddha Basti, Panchamulkwat is there, and Kalka of Pippali and Yashtimadu is being used. So quantity of honey and oil is same as in Yuktaratha Basti. So this is also a good Basti for Shodhana. So you can use it for your practice. Next one. So as earlier mentioned about the Doshatkleshan, Doshar and Dosha Shamana Bastis. So here are the ingredients of Dosha Utkleshan Basti. There are two formulations. In first, Bilva Indraya Gomutra, Bilva Mula, Madhuka, and Shatapushpa is there. And in another is Eranda, Madhu, Hingu, Devdaru, Trifala, and Rasna is there. So these combinations can be used for the doshar purpose. And for Doshotkleshana, Eranda Beach, Madhuka, Pippali, Saindava are used. And after that, lastly, for Shamanabasti, Priyangu, Musta, Rasanjan, and milk are used. Okay, so these are the ingredients of Doshokleshana, Doshahara, and Dosha Shamanabasti. Next slide, please. So this is Guduchi Trifaladi Niruha. Whenever there is a Pitta dosha, dosha samprapti and Rakta Dhatu Dushti is involved, one should go for this basti. So it has kanji, dadim, dadimanda, gomutra, and milk. And in Kalka, it has Vidanga, Rasanjana, Saindhava, Vacha, Pipalli. So these are the contents of Kalka. And decoction, it has Guduchi, Trifala, Rasna, Dashamud. So in this way and in this quantity, Guduchi, Trifala, the Niroha can be used for the Shodhana. And also it has a Rasayan effect. Next slide, please. Kshir Bastis. As we all know, Asthashanam, Vadinam, Panchakarmani, Beshajam. Bastaya Kshir Sarpishi Tiktako Upahitani. So this is the shlok from Charaka Samhita, and it recommends that Panchatikta Rasa Siddha Kshir Basti should be advised when there is a involvement of Asti Dhatu Kshaya. So in that Panchatikta Kshirpak of Patola Neem Vasa Guduchi Kantakari and Panchatikta Ghrita will be used in can be used in Panchatikta Kshirabasti. Yashtadik Kshirabasti is there in Charaka Samhita also. It is mentioned for Vata Rakta and Visarfa. In IBS patient, this basti is appreciated and one can use it. I have used for so many patients and it has yielded so good results. So in this basti, only the Yashti Madhu Kshirpak is there and Grita and Madhu is there. Okay. So in the Kshira Basti, Yapana Basti, you have to add as a prakshepa ghee and other contents. Okay. Next slide, please. Yapana Bastis. When there is the involvement of 2, 3, or 4 stotasas, a patient of Vatvadi has neuromuscular or neurodegenerative disorders. In such cases, Yapana Bastis are the choice of Bastis. So, Mustadi Yapan is widely practiced, and Hapushadi Yapan is also practiced here. In Podar, we practice Hapushadi Yapan Basti. So, there are in the Falashruti of these Yapana Bastis, there are different diseases mentioned there. So, if you find these pathologies in certain patient, so you can go for the these bastis. So the for the Vajikaran or Vrishya purpose and for the Dhatu Prasadana Chikitsa and Rasayan Chikitsa, Hapujadi Yapan and Mustadi Yapan are the bastis of choice. Okay, and Hapushadi basti is basically it is Agni Deepak also. So in the patients where Annava Stotas Dushti is there, you can go for Hapushadi Yapan Basti also. So here are the contents are mentioned here. So next slide, please. So see Vasa, honey, grita, and oil. So many of the bastis, Yapan bastis, these prakshepas are most needed. So this prakshepa acts as a rasayana there. So with the kshirpak of given dravyas, this prakshepa should be added in the Yapana Basti, which act as a rasayana and a vrishya karma. Okay, so this is the Yapana Basti. Next slide, please. So these are the Pakwache Shodhana Basti. So in many patients who has constipation, there is a need of somewhat stronger bastis to do Shodhana. So these Pakwache Shodhana bastis are mentioned in Charaka Samhita. So I use some of them. So there are so many less dravyas are there and the effect is so good. So whenever there is a chronic constipation, one should use these Pakwache Shodhana Bastis. These Pakwache, there are 4 Pakwache Shodhana Bastis mentioned there. First is Madan Faladi, which has Jimutaka, Ikshvaku, Dhamarka, Vatsak, and Madan Fal. And second is the Shamadi Basti, which has Black Nishot, Haritaki, Trifala, Salomana, Danti, and Dravanti. Next slide, please. Third one is Karanjadi Basti, and fourth is Saptaladi Basti. So these bastis are available, and you can use it in severe constipation. It yields very good results. As like this, one another Chatu Prasutik Basti is there, which I use in my practice. It also gives very good results. So these bastis can be used in your practice. Next slide, please. So Prasrutik Bastis. So in Charak Samhita, to counter the Vyapada of Bastis, Prasrutik Bastis are mentioned there. So they are basically mentioned according to the quantity of the bastis. So just now I mentioned the Chatu Prasutik Basti. It has only Taila, Gomutra, Dadimanda and Kanji. So just mix these all and give it. So this is a very simple basti and very useful. I use it in my practice. So in the patients of anaha or constipation, you can use this Chatu Prasutika Basti. Nava Prasutik Basti is there. Whenever there is a Medo Roga or Kapha disorder, Kapha Kafanubandi Vat is there, one can use Nava Prasutik Basti. Brihad Panchamul Kvat is there in this Nava Prasutik Basti. And in a Prasuta Pramana, honey, madhu, ghita, and til tela is mentioned there. So these are the bastis I use in my practice. Next slide, please. Panchaprasutik Basti. I think I have already talked upon this. So next one. Ruksha Basti, Deepana Basti, and Lekana Basti. So these bastis also I use in my practice. See Ruksha Basti. So in this Ruksha Basti, Vaishvanar Churna is the Kalka Dravya, and Sahachara Kwatha is there. So this is I use this in DVT patients of DVT or varicose vein. In that patients, for the Shodhana, I used these bastis, and it is very it has yielded very good results. So this is a very nice basti, one can use it. Deepana basti. So this is there are two types of Deepan basti, or one can say in Charak Samhita, they in the Falashruti the Deepan word is there, but later on Sharangdhara mentioned one of the formulation as a Deepan Basti in Sharangdhara Samhita. So when there is a chronic annavassotas dushti, purishvassotas dushti, and after pachana, there is no improvement in Kshudha, Agni, which happens in patients like Grahani, one should go for this Deepana Basti. So contents are very less and it is very useful. So I use it in my practice, and after the Deepana Basti, it is found that the Kshuddha Vruddhi is very very much improved. So this is Basti you can use in your practice. Here are the contents. Hapusha, Shatapushpa is the main content. Grut is there. Sorry, Sandava, Madhu and Grut are there, and warm water is there. Lekhan Basti, I think so many, it is used widely, and it is for Medo Rog, or for the purpose of Bharakshaya. So many practitioners use Lekhana Basti. So these bastis are need to be used cautiously, of course. But see, until and until you use such bastis, if in the patients of Vata Vyadhi or Dhatukshaya, if you cannot, if you will not perform Stoto Mukha Vishodhana properly, then the retention time of the sneha get reduced. So many times we found that the sneha basti is not retained after 5 minutes or 5 hours or 4 hours. But the reason behind it is basically stotomukha, the improper stotomukha vishodhan. And for that, these bastis are so much useful, and they rapidly perform the stotomukha vishodhan karya. And if you administer it judiciously, it can produce very good stotomukha vishodhana. And after that, if you use sneha bastis, it will yield results uh, nicely. So I recommend everyone to think about these bastis. They are very useful and very good, and has less content actually. I practically so many bastis are there, but the dravyas are not available many times. So one must find such bastis which are useful but has less content. So it is quite uh, good for all patients and doctor also. So these are the Ruksha, Deepan and Lekhan Basti. So next slide, please. Okay, Vaitaran Basti all knows that it is used for Amvata. So it has Saindava, Gud, Chincha and Gomutra in it. Picha Basti, in the patient of IBS, Picha Basti can be used. It has Nagbala, Shalmali, Dhanva. Uh, Kshirpa of this content are very good in the patients of IBS. So Picha Basti is also can be used. So this is from me. I think uh, next slide, please. So this is the end of the presentation. So I tried to put as much as I can in this slot of time. I think that many of you got some knowledge from it. So thanks a lot. Thanks again. So over to Dr. Datta Bapadekar.
Thank you, sir. Next, please. Now we are having question and answer session. So first question is, can we use decoction of Triphala instead of Dashmul in Nirvabasti?
See, Triphala itself is a Ruksha, and for Rukshana Basti or Shodhana, you can use Triphala. In Lekhana Basti, Triphala is the major content, and uh, Dashmul is we do it for the Brihana, Vata Shamana, and that purpose we use Dashmula. So
Okay.
it is actually opposite. It will do the opposite karma.
Okay. Thank you, sir. So next question is, what if the pain has increased after the administration of Basti and how to manage?
Can you repeat, please?
So
I
question
didn't
is,
hear.
what if the pain has increased after the administration of Basti and how to manage? Which type of Basti is not mentioned in the question. They have just stated if the what happens when pain increased after the administration of Basti.
See, no basti will increase your pain. Basically, the bastis are for Vata Shamana. If you give the basti improperly, if you make it Tikshna by adding more Saindava or Gomutra like content, then there will be a cramps in the abdomen. That can happen only. But if you give the basti judiciously, pain will not increase at all. I haven't seen if the basti is administered properly and pain is increased there. There no such thing happens. It can happen that if the pathology is severe, it might happen that the basti cannot subside the pain in one go. So you have to repeat it or think about other basti or add some dravyas. But no basti will increase any pain as such.
Okay. Thank you, sir. For sciatica, which Basti to use in Anuvasan and Niruha?
Sorry.
In sciatica,
Uh,
which Basti to use in Anuvasan and Niruha?
so for Sciatica, as far as we are concerned, we have in our Ayurveda, we have two, we call it Rudrasi, and we have two types of it, Vatas and Vat Kafas Rudrasi. If the Vatas Rudrasi is there, there is a mention of Rudrasi her tel in Bharat Bhaishya Ratnakar. Same mention in Charak Samhita, which has contents like Chitraka, Pipalli, Vacha, Saindhav, Kanji, and Bhallatak. So these tail can be used in sciatica or vataja. And if the kapha vata's grani grudrasi is there, you should go for Edanda Muladi Niruha along with the grudrasi har taila basti. So this combination can be used to treat sciatica or grudrasi.
Thank you, sir. So next question is, which oil should be used for Dipan Basti?
Til tel.
Okay, sir. Sir, next question is, can we use Gomutra Arka in place of Gomutra? If yes, then what would be the dose?
See, Gumutra Ark is far what do you say, concentrated and more tikshna than the Gomutra. If you have to use Gomutra, then dilute it with water. So if you are taking 10 ml or 20 ml of Gomutra, then add the double number of the water in it and use it. So you need to dilute the Gomutra Ark before using it as a in place of Gomutra.
Okay, sir. Thank you, sir. Here we end with our question answer session. Next, please. I welcome here our today's chairperson, Dr. Ritu Wadhwa, madam. She is a senior Ayurveda academician and Panchakarma specialist. Madam has done BMS, gold medalist, MD and PhD. Madam has used more than 23 years of academic and clinical experience in Ayurveda. Currently, Madam is a professor and HOD, Department of Panchakarma, Dr. D.Y. Patil School of Ayurveda, Nerul, Navi Mumbai. Madam has research and publications, author of 3 books and 30 plus research articles. Madam has worked as a speaker at national seminars, webinars and workshops, and special recognition, a university gold medalist in BMS. Over to you, ma'am. Ritu Wadhwa, madam.
Yeah. Am I audible, sir?
Yes, madam, you are audible.
Yeah. First of all, congratulations to Dr. Rajiv Tarpe, sir, for delivering a comprehensive and thought-provoking presentation. Thank you so much, sir. As
Thanks,
said in
ma'am.
Ashtanga Hriday, Basti Vatharanam Shrestha. We know that Basti is considered the best and most effective therapy to manage Vata disorders. In Charak Samhita, Acharya Charak has described Basti as Ardha Chikitsa. That highlights the supreme importance of Basti in Ayurvedic treatment. In the modern era, where lifestyle disorders, stress-related illness, and neurodegenerative conditions are increasing day by day, the relevance of Basti Chikitsa has become even more significant. Regarding today's session, Dr. Rajiv Tarpe sir highlighted various points regarding Basti that has highlighted classical foundation, clinical application, and practical relevance of Basti Chikitsa. Today's lecture reminded us that Basti is not merely a Shodhan procedure but has multidimensional action, which detoxify the body, pacify the Vata dosha, and nourishes tissue and restores a systemic balance simultaneously. The way sir has explained various types of Basti formulation and their indications was truly remarkable. Thank you so much. At last, I extend my gratitude to Gurukul Global Academy for arranging this lecture series and providing valuable academic platform for the students and practitioners. Thank you, everyone.
Thank you, madam. Next. As we all know, we are today in 3rd lecture series. Next. Tomorrow, 19th March, we will be having on topic Healing through Elimination, the Power of Rakta Moksha, and guest speaker would be Dr. Datta Bapardekar. Next, our clinical meeting would be on 20th March. Topic would be anti-diabetic medications and Panchakarma, and our guest speaker would be Dr. Atul Pawar sir. Next, On 21st March, the topic would be Nasya Karma, a practical approach to health maintenance and disease management. And our guest speaker would be Dr. Prasad Kulkarni, sir. We offer you online course on essential Panchakarma. This is a 3-month online course which you can communicate with us for taking admission. Next, please. We also offer research methodology and biostatistics. This is a 1-month online course on research methodology and biostatistics for Ayurveda MD first year students. This is starting from 1st April. Next, please. As we come to the end of today's insightful session, it is time to express our heartfelt gratitude to everyone who made this event meaningful and successful. First and foremost, I would like to extend our sincere thanks to our esteemed guest speaker, Dr. Rajiv Tarpe, sir, for such an enlightening and knowledge-rich session on principles and practices of Basti Chikitsa. Sir, your depth of knowledge, clarity of concepts, and practical insights have truly enhanced our understanding of this important Panchakarma therapy. We are grateful for your valuable time and contribution. I would also like to express our deep appreciation to our respected chairperson, Dr. Ritu Wadhwa Madam, for her gracious presence, guidance, and constant support. Ma'am, your encouragement and leadership continue to inspire all of us in the field of Ayurveda. A big thank you to Dr. Bhalchandra Mahamuni sir and Dr. Viraj sir for organizing this wonderful 6-day webinar series and providing such a valuable learning platform for students, practitioners, and Ayurveda enthusiasts across the country. I also like to thank our technical team, Mr. Yash and Mr. Ayush. All our participants, thank you for active participation, keen interest, and engagement throughout the session. Your enthusiasm made this session even more interactive and impactful. We hope today's session has added value to your knowledge and will help you in your academic and clinical journey. Do join us for upcoming sessions in this webinar series, where we will continue to explore more important aspects of Panchakarma. With this, we conclude today's session. Thank you once again to everyone. Stay safe, stay healthy, and keep learning. Have a wonderful day ahead. Thank you.